So when people get sick, they often want to take medicine to help themselves feel better. So let's go ahead and start with a patient so we can explore how medications are prescribed and paid for. So suppose our patient here wakes up in the morning, he just feels a little run down, feels a little under the weather, has got a little bit of headache, maybe a little stuffy nose. Not really sick enough to go to a doctor or go to a hospital, so he just travels to the local pharmacy and then walks down the aisles and picks up a bottle of maybe a pain reliever or decongestant to help with his cold. So that is called an over-the-counter medicine because he can just buy that over the counter at the drugstore, doesn't need any special permission, and he just pays for that out of his own money. That is called an out-of-pocket expense. So it's just like any other basic consumer good. You just go to the store, you buy it, and then hopefully you're satisfied with the purchase you made. Now, on the other hand, let's suppose our patient woke up and he's got a high fever, got a sore throat, maybe his son or daughter has strep throat. He's worried he has strep throat. So he goes to see the doctor does a throat culture, says, yep, you have strep throat. And then that doctor goes ahead and writes up a prescription, sends that prescription to the pharmacy, and the pharmacy assigns that to a pharmacist, goes to the back, and comes up with a bottle of antibiotics for our patient. Now that is not something you can just walk in and buy. You have to have a prescription, so that's called a prescription medication. Now a prescription medication is often also has to be paid for, and usually if you have a prescription medicine that's paid for by a combination of insurance, assuming you have health insurance, as well as some out-of-pocket contribution from our patient. And we're going to talk about that a little bit. Before we get to how medicines are paid for, I just want to give you a sense of how often people take prescriptions. It turns out that people between the ages of about 19 to 64 years old per year, on average, will get actually about 12 prescriptions. And then once you're a senior citizen, 65 years or older, that number increases. So they, on average, fill about 28 prescriptions per year. So you can see how these numbers really add up over time. So many people are taking medications prescribed by a doctor. And because those pills can become quite expensive, those medicines can start to become pretty expensive, that's why insurance was developed. And so let's talk a little bit about generally how people pay for medications. So suppose you've gotten a prescription. I'm just going to draw a pill bottle here. And you have, say, been given a 3-month supply of this medicine. And let's further say it's fairly expensive. It costs about $200. So we're going to talk about two concepts related to how medicines are paid for. A co-pay and then a deductible. So a copay would work like this. If you wanted to get your medications, I'll go ahead and draw this in green, a patient, I'll just write PT right here, would have to pay a contribution, say about $10. The insurance, as I draw as INS right here, would pay the balance, which is $190. So this portion right here is referred to as a copay, and the insurance company offers a $190 benefit. So if you look at the back of an insurance card or a prescription drug card, that's one of the really important pieces of information that might be on there. It'll say right there copay, and then it might say $10 for medicine. Another way a patient might have to pay for medicines is that in the beginning, the patient may have to pay all $200, and the insurance company would actually pay $0. That's just for the first prescription. But let's say this person, just like many people, has many prescriptions, and over a period of time has to purchase several of them. And after a while, it turns out the patient has paid, say, $400 in medications. and the insurance company still hasn't paid anything. But it turns out that our patient has what's called a deductible. So what happens is that after you spend a pre-specified amount, say $400, after that period of time, the insurance company now starts to kick in all the costs of the medications. So two important concepts, again, to understand with medicines and with other insurance products is both a copay and a deductible. So somebody might look at this and say, why is this so complicated? And probably the best way to understand it is that medicines themselves are complicated, because medicines themselves come in very different forms, and we'll talk about that. And medicines also have a lot of choice. And so insurers and patients, you want to try to get them to get medicines that work well but at a reasonable price, and also choose the medicines that are economical if they're going to have pretty much the same effect for a patient. On the other hand, if you're a pharmacy or drug company, your incentives are different. You want to sell people the most expensive medication. And so that's the tension that leads people to develop these complicated ways to try to get the best result. So let's talk about the different forms of medications. And here I want to explain that when somebody first invents a medicine, suppose they've come up with a fancy pain medication, and they test it in the lab, they give it a generic name. So a generic name is kind of like what the product is. So if you go to the store, it might be called, say, this pill might be called acetaminophen. And I'll come back to what that is. And it's kind of like if you go to the store and you're buying pasta. It's just spaghetti. It doesn't matter who makes the spaghetti. It's just a generic name of that product is spaghetti. Similarly, the generic name of this product is acetaminophen. But then if the drug is successful and this company gets a patent on it, they also give it a brand name. And for acetaminophen, that brand name, which many of you may know, is called Tylenol. So it's just like if you buy spaghetti, there's a company that makes a really great form of spaghetti. They're going to come up with their own name, like Spaghetti Prince or Spaghetti King. So this is essentially the same medicine, but there's different names for it. And then over time, after the patent is done, other companies are also allowed to make the same medication. And so then you have a choice between buying the brand name, Tylenol, or the generic name, and then, there might be all kinds of other names given to it. You have to read the label at the back, but they're all other forms of Tylenol, or what might be more commonly called acetaminophen in a generic name. Now, imagine you're the company that invented this. Even though it's freely available, you're still going to charge extra for this because it's the brand people know. People may not even understand that acetaminophen is the same as Tylenol. So Tylenol may cost a little more, whereas generic acetaminophen, even though it's exactly the same medication, because people don't realize it, might be priced a little less. I've gotten into this a little bit of detail because if you're on the hook for paying a copay or deductible for a medication like this, Tylenol is over the counter, so that's, that doesn't apply to it, but many other medicines are like this. But still, your insurance company is going to want to drive you to try to purchase this form of medicine and not this form, because then the insurance company doesn't have to pay a large amount. Remember, if you're just paying a copay, say for these medicines, the insurance company is still paying a lot, so they're strongly incentivized. So they're going to give you a very high copay for something like a brand name medicine, and maybe a lower copay for a generic medicine, because that's what they want you to buy. Now, we've talked about different forms of the same drug, but you can also make different choices among different drugs as well. So suppose you have high blood pressure. You might have pill A, which is a medication, say, that is effective for blood pressure. It's very beneficial for blood pressure, and it's cheap. It's been around a long time. It's even available in a generic form. However, there's pill B, which is a brand name medicine. It's a completely different kind of medicine. It's on patent. It might be even 3 to 4 or 5 times more expensive. Suppose this medicine is $500 for a course. A generic medication is only $20 per course. Well, how do you encourage your physician to sort of prescribe you the one that might be cheaper and likely equally effective? Well, one way to do it, again, is to actually have the pharmacy say, well, we have a preferred medication or a preferred what's called a formulary. We're only going to carry or cover this medicine up here, and therefore this one is not covered by our plan really to the same extent. So we're going to charge much more money for that. So in brief, to review, what pharmacy benefit managers and your insurance benefit coordinators do is they, through the system of co-pays and deductibles, tries to encourage you to first of all get a generic drug when possible over a brand name drug, and not only that, choose drugs, even different kinds of drugs, among them choose the one that's cheaper and probably the most equivalent. So that's one of the reasons why the system has become so complicated. So I'm going to go ahead now and talk just a little bit about Medicare and how they cover prescription drugs. So just take a minute, because this is another thing that is very important for people to understand. I'm just going to go ahead and erase this part right here because I think that we want to just keep our board a little bit clean and talk about Medicare. So Medicare's prescription benefits began in 2003 with the passing of the Medicare Modernization Act. And in 2003, so the Medicare Modernization Act, and Medicare, as you recall, I'm just going to draw our little graph right here of our population of 300 million Americans. Medicare applies to a pie slice that's about that big. It's mostly seniors who get medicines through them. But this was through a program called Medicare Part D. I'm mentioning this because this is one of those things that is a big part of the federal budget, and it's important to be familiar with the fact that Medicare also now covers prescription medications. And what they do is very similar to what private insurers do with co-pays and deductibles. Medicare covers, let's suppose this is how much money somebody is paying out of pocket. And so I'm going to increase money there. So what they'll do is, for the first little bit of the amount of money right here, this is going to be co-insured by Medicare. So Medicare pays some of the money, and the patient pays some of that money. Then as the expenses rise, the patient has to pay most of that money right here, and insurance is not going to pay money. And then once you kind of keep spending money, finally then Medicare starts kicking in money again and protects you against what's called catastrophic coverage. So this right here is sort of the shared expenses, and so you get some help from the government. But then as you spend more and more, you kind of get in the situation where a patient, right here, this is the patient and this is the government, has to spend much more, and this is called the donut hole, because that is sort of the middle in which the patient has to spend a lot. And then finally here, this is what's called catastrophic coverage, and this is where patients may have really spent a great deal out of pocket and the government starts to kick it in again. One of the things that people have really worked on is it possible to sort of give patients a little bit more help in this section so they don't get wiped out if their expenses go up a little bit more. And that's called closing the donut hole, in case you ever hear that in part of discussions in Part D of